You've probably had your healthcare provider share with you or one of the relatives that you're taking care of about restriction of salt intake, and maybe you didn't understand what they meant. And it's not because your doctor does not care or wishes you to live a miserable life by eating food with no salt. You know it's always not tasty. But it's because your doctor cares about your health and also understands very well the effect of long-standing high salt intake to your blood pressure and also to the kidneys and the heart. Today, we are going to share about the effects of high salt intake to your blood pressure and also your kidneys and your heart. And if it's your very first time to watch my videos, please subscribe my YouTube channel, Health Awareness Tips with Dr. Mercy Kalenzi. You can also ask your questions, leave a comment for me, and share my videos. Stay tuned. I'll be right back. Talk about high blood pressure, then you need to think about or figure out what happens to your kidneys and also your heart, because those two organs are majorly affected by chronic long-standing high blood pressure. And so to talk about the kidneys in particular, the kidneys are responsible for excretion. They wash out and filter any toxins from your blood. And so, with too much salt intake, the kidneys fail to perform their function. When we take in too much salt, we make it harder for the kidneys to play its role, because high salt intake causes fluid retention. High sodium, too much sodium causes fluid retention, and this unwanted excess fluid that is retained in the body will put a lot of stress on the body system, on the blood vessels, and at the end of the day, you will get what we call high blood pressure. That's how high blood pressure comes in. Over time, when somebody is taking in too much salt, high salt intake, over time they get high blood pressure. And when someone is living with high blood pressure for a long time, their blood vessels begin to stiffen and also narrow. When they narrow and stiffen, when they get harder, it means blood and oxygen flow to the most important organs will reduce. And what happens? The heart will put incredible energy. It will strain, it will stress a lot to make sure it still pumps enough to supply all the other blood that is necessary for your body to continue performing. And what happens with this stress? Your heart begins to enlarge. The left ventricle begins to get bigger. And the more it enlarges, the more it increases in size. It means also the ability to contract and relax also reduces. So in a long run, as your heart muscle is getting weaker, you get what you call heart failure. So that is why you find that most patients who are living with hypertension, they also get kidney disease and they also end up with heart failure. So what happens with all those comorbidities? It puts you at a risk of poor prognosis and also someone having a stroke, which is also difficult to deal with. And now my call is that we encourage one another, encourage your relatives, your friends. Tell them about the effect of increased salt intake to their body. Thank you so much for watching the video. I'm so grateful. May the Lord bless you. I encourage you to share the video, to comment, leave the questions with me, and I'll be able to answer. Until the next video, thank you.